And so thinking about the wellbeing strategy, Hayley, you went through a process of reimagining what you were going to do and rebranding that approach. And I was just wondering what you need to do to understand and work out what your wellbeing strategy should be. And also, therefore, what kind of benchmarking you need to do to then see how much progress you've made. I was wondering if you could talk to that, having just been through that journey.
I think strategy is all about what it means to your business. So what does well-being, health and safety mean to you? And what is your data telling you? So what are your potentially lagging data, because it might be all you've got, be it absenteeism, engagement surveys, which you could argue could be more leading, occupational health data, employee assistance program data. What is it telling you, and what are your focus areas? That really helps you, I think, develop some of your key potential campaigns or initiatives that you want to focus on. But I think there's that element of education and awareness for individuals. So that's kind of frontline. You've then got your line manager pocket that you need to focus on in terms of competency and training. And then you've got that tone from the top, which is the C-suite, and thinking about how they can role model, storytell, and behave. And I think that comes to objective setting and accountability. So in terms of measuring, I do not think that anybody has hit the golden nugget on measuring health and well-being as yet. What we do is maturity. So looking at the maturity in terms of well-being performance indicators that we set ourselves. One of them in there is actually health surveillance, because we need to have the solid foundation. Otherwise, you are building a house on sand. And if you're not looking after the kind of physical risks that might be impacting, you can't really start doing things in your well-being strategy without looking at the risks that are inherent already. So I think it needs to be personalized to each organization. Risk-based, as I've mentioned, I am a strong believer of a risk-based approach through risk assessment. That way you can start to monitor hazards, control them, monitor the level of risk that you're seeing, and also consultation and focus groups. And I think that what was great about this piece of work that we did over, we had 3 interviews with different key stakeholders. Qualitative data is also really important in this space, not just quantitative. And that really helps demonstrate that impact.
Absolutely, it's a really broad range of measures.
Yeah, there's no one size fits all, unfortunately.
Absolutely. And Claire, I wondered if there are any other KPIs that you saw organisations use across the projects, and also how they decided to measure that progress against them.
Yeah, that's an interesting point. I'd say, really, to reflect again what Hayley has said, there's no easy answer to this question in terms of well-being KPIs. And I'd say that for the most part, the organisations that we saw looked at general measures of engagement. So sometimes people look directly at well-being, and sometimes broader measures of engagement. They looked at feedback and engagement with the particular interventions that they had on offer. But they were also assessing their maturity. They were also assessing how well they offered support to particular groups. So some of the things that we saw during the research and during the course of the pandemic, following, for example, a realization that people with disabilities or pre-existing kind of mental health problems actually were experiencing the pandemic more negatively and experiencing organizational responses more negatively than other groups, was a kind of growth in the efforts to actually meet the needs of those particular groups. And that was a performance indicator.
Yeah.
Also, that risk-based approach, not just in terms of health surveillance, which Hayley's mentioned, and that risk-based approach for frontline workers, but also assessing risks for workers who were, for instance, transferred to home working practices and might face particular risks in those environments, such as from domestic violence. We saw many measures to look at how the needs of those groups were being met.
Thank you. I think it really shines a light on the need to have a diverse and multi-method approach, doesn't it? And also looking outside of your organisation, because you only know what the answers to the questions you're asking. And sometimes we're not asking the right questions. So we might need to ask different questions to be able to identify pockets of risk or even pockets of strength that we might not be recognising in what we're doing.